I've been around a long time doing this, and I'm here to tell you that what you're doing is critically important. The Colorado Health Foundation has as one of its basic premises the importance that we see of people being insured and having some sort of insurance product. We understand that's not the answer in and of itself, but we understand the critical role that that plays in the next step. And that next step, once you have an insurance product, being able to have access. That's what you're helping to provide right now through the work that you're doing with enrollment and building better health. Once someone has access to care, they can go to a primary care clinician and to a site where not only do they have access, now they have the opportunity to engage in their own health care, the opportunity to be part of changing how they look at health and how health becomes them and can become them. And as a primary care physician who sees patients on a daily basis almost, I'm here to tell you that my life has changed because of the work that you do. That's the historically important part of what you're doing that I really want you to understand, and I pat you on the back for. The job that you do is very difficult, but you're very well prepared. Our goal at the Colorado Health Foundation was to make a contribution, along with our other partners, including HCPF, to making sure that we could do exactly what I said on the front end. Help you understand the changes that have occurred most recently during the last year to what the work is that we're doing, to make sure that you understand that there are a lot of resources out there that you can tap to help you do your job better, and to look around and feel the support from those that are here today saying, we're in this together. That's not easy to do. You interface with the public at a level that very few folks do. You get to understand the problems that they deal with on a daily basis, trying to go through that whole mirage of what does this mean in terms of coverage and what kind of policy and what's the best for my family and how do I do that? That's what you're experts at. And when you do that, they're able to access a primary care clinician. And I can tell you, in the course of the last year, just in the course of the last year, where I work at the Salud Family Health Centers, and we have some of our wonderful staff here today, we have today over 11,000 patients that a year ago had no insurance whatsoever. They're now covered. The way, give yourselves a clap. They are part of those 300, now moving towards 400,000 people who are having insurance in the state of Colorado because of the work that you do. Because of the work that you do. That's a historically important part of what's going on. On a day-to-day basis, I have stories and patients that I could stay up here all afternoon talking about. Now we can do some of the things that we weren't able to do before. Today, I'm able to provide care for them in a way that my hands were tied before, and I couldn't. Why? They couldn't afford to go to some other ologist to get something taken care of. They couldn't get that elective surgery that they really need. Elective just meaning not, oh, I just would like to have it, but their life doesn't depend upon it, but they still need that. That you have changed. That is historic. And I would say without a doubt that what you're doing is participating in one of the most fundamental changes in our healthcare system in the history of our country. And let me tell you why I believe that. I believe that because if you look back at the 20th century and think about Franklin Delano Roosevelt and his administration when he came in during the Great Depression, one of the things, and the most fundamental thing that he did, I think, that makes him one of the outstanding presidents of his era, was to get us as a country and as a society to understand that we have an obligation to each other. We need to maintain the social security of our nation. And he put that into play. And he changed the consciousness of how we look at our responsibility for each other. Now, it took 30 years, but 30 years later, we take another huge leap forward, and Lyndon Johnson then is able to put through Medicare and Medicaid, We as a society saying there's at least a part of this population that we think needs to be covered. Not everyone yet, but a part. That was a huge jump for us. Historically important is the role that you're playing. How does that fit in? Now it takes another 20 years. Fast forward to 1985 and the passage of a law called EMTALA. Anybody here know what that stands for? There's someone in the back. The Emergency Medical Labor and Treatment Act. Now, when I started as a young community organizer in Rocky Ford in 1973 and started a clinic there, those were the pre-EMTALA days. And it's hard to believe today, but if you went to a hospital in those days and you did not have money, you could be turned away, and it was legal to do that. It was not extraordinary to do that, and that happened on a regular and routine basis in our country, in our society. We passed a law in 1985 that said that can no longer happen. If someone comes to the hospital, you have to make sure they're not having an emergency before you say find care with your PCP or go somewhere else. That was historic. That changed how I practice. Also, incredibly important. And me, just the generic primary care clinician, okay? Just that. Now we fast forward another 30 years and we get the Affordable Care Act, and that's what you're part of. That's what this whole push is a part of. That's what building better health is a part of. That's why the role that you play is so critical and so difficult. And we appreciate that. The Colorado Health Foundation appreciates everything that you're doing on a daily basis to help people get covered so that that coverage will lead to access to care, and that access to care will lead to an elevation in the healthcare status of people that live in the state of Colorado. Because our mission is unchanged. At the Colorado Health Foundation, our mission is to make Colorado the healthiest state in the nation. And we can do that if we work together at it. And that's the role that you're playing. It's not an easy role, but you're dedicated, you're motivated, you are ready to do this, and you are on the verge, and you are participating in one of the most important historical changes in our healthcare history, bar none. Wow. It's pretty hard to beat that. Pretty hard to beat that. And what I say is I'm proud to call myself one of you. I'm proud to be on your team. I'm proud to be building a better health and healthier system for the state of Colorado. So thank you for your efforts. Thank you for all you do. And on part of the Colorado Health Foundation and our other partners that help bring this together, thank you for taking the time to participate and do such a wonderful job. Let's go get them, okay?